Most common heart related issues that the COVID patients are facing. They are divided into three categories. First is acute coronary syndrome. Due to atherosclerotic plaque shift, there and the COVID is a prothrombotic condition. So because of these two reasons, there can be obstruction of any coronary artery, maybe left main coronary artery or its branches like left anterior descending coronary artery, left circumflex artery, or the right coronary artery. So the heart attack can occur in these set of patients. Then the second thing is the acute myocarditis. The patients are having palpitations, the fever, and chest discomfort or shortness of breath. So in these set of patients, acute myocarditis patient is having inflammation in the heart muscles. So this is the second phase, and third and the last, when the patient is having severe inflammatory response, when the cytokine storm is there. So some patients may aggravate the patients with having arrhythmias, and the patients in which the atrial fibrillation is there. Now coming to the post-COVID heart-related problems. The thing is, after the patient recovered from the COVID, sometimes the patient can feel palpitations, chest discomfort or pain. Then the patient can have shortness of breath, the feeling of lightheadedness or dizziness, especially upon standing. Or you can say that postural orthostatic tachycardia syndrome, POTS, POTS, and the patient can feel severe fatigue. So in these set of patients, you have to go to the clinician and the cardiologist immediately. He will do all the investigations and diagnose the condition by doing ECG, echocardiography, or if the need arises, CT scan or MRI. Because in these patients, not in acute but in later stage after recovery of the COVID, sometimes patient can have microvascular obstruction in the heart. So we can diagnose on the basis of the cardiac MRI, and by seeing this, because the patient, this is a prothrombotic condition, and in the COVID is a prothrombotic condition, and if the patient is having increased D dimers, increased inflammatory markers like interleukin 6, ESR, CRP. Now, what should people not do in these set of conditions? So when you see these conditions, the patient is having chest discomfort, shortness of breath, any palpitations, you don't have to stay at home. Very, very important. You don't have to stay at home. You don't have to think that the patient will recover by its own. You have to rush to the physician, you have to rush to the hospital, you have to rush to the cardiologist to get the things in check, and take the proper treatment at any cost. The thing is the most important thing in these things is, if you will have good COVID appropriate behavior, if you apply good mask, if you do good mask covering both nose and mouth, if the patient is following the social distancing, the 2 meter or 6 feet distance, or and hygiene and hand hygiene, after every 30 minutes, for washing hands for 20 seconds with soap or any 60 to 70% any alcoholic hand sanitizer if the soap is not available. So if there is no corona, you will not face these such of problems. No corona will be there and no heart conditions will be there. So the COVID appropriate behavior is very, very important. What should people watch out for as a preventive measures? So there is a very well saying, prevention is always better than cure. So thing is, COVID appropriate behavior, which include 4 things. First and foremost, the mask covering both nose and mouth. Second, the social distancing. 2 meters, or you can say 6 feet. The hand hygiene, 30 after every 30 minutes for 20 seconds with soap or any you can say the isopropyl alcohol containing 70% alcohol. Then the vaccination. Then the fourth thing is vaccination. We have to vaccinate each and every individual. At least 70% we have to vaccinate the Indians, so that we can get adequate herd immunity, which can save whole Indians. Then immunity boosters. You have to take vitamin C or zinc. Naturally, you can take vitamin C in the form of amla, the lemons, the tomato, papaya. You can take all these natural ingredients. Then the thing is, best medicine ever made by God is food. So eat adequate and healthy food. The diet is very important. Then you can have drink plenty of water, 2 to 3 liters of water a day.
Subscribe to One India channel and never miss an update.